Prime Minister Dr. The Right Honorable Keith Mitchell to address the nation on Friday. We'll have details to this story and more in the National Report. With the details to the news for Thursday, September 2nd, 2021, I am Chrisanne Mitchell. Prime Minister Dr. The Right Honorable Keith Mitchell will address the nation on Friday, September 3rd at 8 p.m. to highlight government's plans to address the current COVID-19 situation in Grenada. Dr. Mitchell, who is also chairman of the cabinet, convened a meeting this afternoon to discuss with his colleagues recommendations shared by the COVID-19 subcommittee, which functions as an advisory body to the government. The committee's recommendation will help to inform government's approach to navigating through the current crisis. Government is also making good on its promise of continued collaboration, particularly as it relates to the COVID-19 pandemic. It is hosting consultations this week with representatives of various sectors. This afternoon, more than 125 representatives of the business community engaged in a consultation spearheaded by the Ministry of Finance and which the Prime Minister also attended. On Friday morning, government will meet in similar fashion with trade union representatives, and there has been ongoing discourse with members of the religious community as well. The Prime Minister's address will be broadcast live on GIS Channel 22, the GIS YouTube and Facebook page, radio and TV stations, and other media platforms at 8 p.m. Grenada continues to record a significant increase in positive COVID-19 cases. The Ministry of Health on Thursday, September 1st, confirmed 125 positive cases, the highest for the week so far. This brings the country's total active cases to 449, with 440 of them being local cases. Since the start of the pandemic, 4 deaths have been recorded, 3 of them for this week alone. The total confirmed cases from March 2020 stands at 664, and to date 212 individuals have recovered from COVID-19. The ministry's vaccination campaign continues at various locations across the island, including medical stations and at the National Stadium. Several pop-up clinics have also been organized to increase the country's vaccination rate to obtain herd immunity against the global pandemic. So far, over 25,000 persons have received the first dose of the vaccine and over 19,000 received the second dose of the vaccine. This figure includes both Pfizer and AstraZeneca vaccines. Acting Permanent Secretary in the Ministry of Social Development and Housing, Chrissy Worm-Charles, says her ministry will expand its support for education, empowerment, and development program SEED to include families who have slipped further into poverty due to COVID-19. The expansion falls under the government's $36 million COVID Economic Stimulus Program 2.0, which will provide relief to single-headed vulnerable families for 6 months. The second stimulus package is being funded through the Caribbean Development Bank under the Inter-American Development Bank, Caribbean Development Bank Global Loan Program, and the Government of Grenada. P.S. Worm-Charles explained that the financial assistance will act as a buffer against the economic shocks caused by the global pandemic. Middle-income households that are now low-income due to unemployment will also benefit under the cash transfer initiative.
The expansion program would be for 6 months, right? Persons, they would be vetted. They would have to go through a testing, a PMT test, to ensure that that we meet the qualifications of the program. And once the person qualifies, and they will be able to receive some benefits, and that would hopefully go a very long way to help cushion, the impact of the COVID financial shocks on the families, ensuring getting, what's necessary to, to improve the quality of life.
$1.35 million have been set aside for youth entrepreneurship under the Division of Youth Development. The subcomponent 2.2 will provide support to expand youth entrepreneurship and programs. Acting Youth Coordinator Royden Bihari said over 1,500 individuals between ages 15 to 35 will benefit from training to enhance their capabilities and skills to become business ready.
We are looking for persons who are not gainfully engaged employability-wise to ensure that we can engage them to enhance their capabilities and capacity to actually be ready for the job market. The component focuses on specified population segments with training sessions to enable them to build a capacity towards the establishment of businesses to enter the job market in the state of Grenada so that they can be job ready.
The Division of Youth plans to engage a new cohort of trainees every 6 weeks. Each beneficiary will receive a stipend of $700 for the training duration. Bihari says the division will continue to work with existing partners, NULO, National Training Agency, and others to accomplish the training mission.
The overall objective of this subcomponent is to look at the skills and technical capabilities of potential and current job seekers. And this will be implemented through initiative led by the Division of Youth Development with other potential partners and implementing agencies such as some of the existing ones in Grenada like the CEDAP, NULO, the SIEP, the GIDC, the GDB, and our own Youth Bees project here at the Division of Youth Development.
Unemployed adults and single-parent households are eligible to benefit under the subcomponent. The Ministry of Finance launched the COVID Economic Stimulus Package 2.0 on Wednesday. This is the National Report. The news will continue after the break.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus, and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787, or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. Help prevent the spread of COVID-19. This has been a message from the Ministry of Health.
Welcome back. Medical officer in the Ministry of Health, Dr. Mariana Charles, says the rapid antigen test can only detect the antigens of COVID-19 and not symptoms of the common cold. Dr. Charles made the statement in response to concerns on social media that the majority of positive cases are individuals exhibiting symptoms of the annual flu. In addition, it is the belief of many that the rapid test can detect antigens associated with other illnesses like the flu. Dr. Charles emphasized that the rapid antigen test can only detect the antigens of COVID, which makes it useful in determining COVID-19 cases.
That antigen test, right, it is specific for COVID-19 in that it detects the protein produced by SARS-CoV-2, which is the virus that causes COVID-19. Now, as it relates to other viruses, right, they will produce different proteins, and those proteins will not be detected by a COVID-19 rapid antigen test. That test is specific for COVID-19. Now, as it relates to antigen tests, the main concern for antigen tests is what we call false negatives. By that I mean we have persons who are asymptomatic. they've been in contact with a positive case or a suspected case and the antigen test come back negative. This is our concern, right? Because again, the sensitivity of that test, meaning its ability to detect a positive case when persons are not experiencing symptoms, is lower, right? And with that in mind, right, our recommendation that for these persons, they still are required to quarantine for a period of 14 days. And we retest them, we do 2 tests for them, antigen test on day 7 and on day 14. Just in the event that we missed on day 7, and that was a false negative, we will be able to pick it up on day 14.
In the beginning of the pandemic, the Ministry of Health used PCR tests as the determining method for COVID. Currently, the ministry is using both rapid tests and PCR tests to confirm COVID-19 cases. Dr. Charles explains the reason for now using both PCR and rapid antigen tests to confirm positive COVID cases.
Currently, Grenada is at a stage where we have community spread of COVID-19. By that I mean you have cases in the community and persons do not know, for instance, where or whom they got it from, right? So since we have confirmed community spread, we have started using this method. And this method is not unique to Grenada again. This method is even recommended by WHO and is also being used in other countries throughout the region to detect positive cases in the context of community spread.
Finally, in the news, the acting chief magistrate in the magistracy department says all pending court matters set for hearing during the period September 3rd to 17th in all of the magistrates' courts in all magisterial districts are adjourned. A public notice from the magistracy department states that new dates for hearing will be communicated to all involved at a later date. The notice also states that all magistrates' courts offices in all magisterial districts will remain open for